Hi, I'm Sol. I'm a third-year nursing student, and I'll be demonstrating how to administer med through IV using a mini bag. So I've gathered all my supplies here, and I picked up my meds from the med supply room, and I have my mark. So I'll do my first med check. This is for John Smith, who has no known allergies. The drug name is Ceftriaxone. This is also Ceftriaxone. The dose is 1.5 grams, and because one vial has 1 gram, I grabbed another 1 gram vial because I need more. The route is through IV, and the time is every 24 hours, and it is due now. Also, I'm looking at the expiry date, and it hasn't expired. According to the parental drug monograph, Ceftriaxone is an antibiotic, and this is appropriate because this patient was admitted with a respiratory tract infection. And according to the policy, this can be administered by a student nurse, which is applicable to me because I'm a student nurse. The usual dosage goes from 1 to 2 grams IV every 24 hours, and the ordered dose is 1.5 grams every 24 hours, so it's within safe range. And because this vial comes in a powdered form, I need to reconstitute it. So for a 1 gram vial, I need to add 9.6 milliliters of sterile water to get a final volume of 10 milliliters. And I'm giving this IV intermittently, so I need to dilute this in either a 50 or 100 milliliter of D5W or normal saline. And the mini bag that I chose was 50 milliliters of normal saline. 50 milliliters because this patient is already receiving adequate fluid from his primary infusion, and normal saline because that's what's already being infused currently to the patient. And I'm going to administer this for 60 minutes because this patient has an appointment in 2 hours, so I want to give this med before that. And the PDM states that I could administer this for 20 to 60 minutes, so the time is appropriate. And I'm looking at the back, and I can see here that this drug is compatible with normal saline. Now, before I prepare my drug, I'm going to do hand hygiene. I'm going to take out my sterile waters, and I have my vials. I'm going to alcohol swab each of these vials. So for 30 seconds, I'm going to swab the top, and then let it dry for 15 seconds. And for the sake of time, I'm not going to rub it for the complete 30 seconds. Okay, so while it's drying, I'm going to prepare my syringe. I have a 10 milliliter syringe and a blunt fill needle. I'm going to open it carefully so as not to break sterility while I'm connecting it. And I'm going to do the same for this second set of 10 milliliter syringe, and I'm going to use this later. Okay, so according to the PDM, I need to add 9.6 milliliters of sterile water. So I'm going to draw up 9.6 milliliters. Inject it, and then collect it. Okay, being careful not to touch the tip. I'm going to make sure all the air bubbles are gone, and there aren't any. Taking this out and putting it into my first vial. I'm going to allow the air to escape to relieve pressure. So this one's done. Then I'm going to do the same thing for my second vial here, 9.6 milliliters. Okay. And, getting rid of the air bubbles. I'm going to inject it into my second vial. All right, I'm going to safely recap this. And I'm going to roll these so that all the particles get dissolved. And it looks like a clear solution. And I'm also being careful not to touch the tops while I'm doing these. Okay, and they're clear. And now, because I have an ordered dose of 1.5 grams, I need to first pull up 10 milliliters from my first vial to get a dose of 1 gram. And then from my second vial, I'll pull up 5 milliliters to get the rest of my 0.5 grams. So the total volume I'm pulling up is 15 milliliters for the ordered dose of 1.5 grams. So I pulled up 10 milliliters into my first vial here, injecting, collecting. Okay, so I got around 10 milliliters. Getting rid of any air bubbles.
Are you done?
I'm going to recap it. And then 5 milliliters for the second vial. Alright, so before I dilute it into the mini bag, I'm going to do my second med check. So here, my vials and my MAR and my syringes. This is for the patient, Mr. John Smith, who has no known allergies. The drug name is Ceftriaxone. The ordered dose is 1.5 grams, so I have my 15 milliliters, which equals 1.5 grams here. The route is through IV infusion, and the time is every 24 hours, and it's due now. Alright, so I'm just gonna do this because I keep touching my hair. And, what else? So I've got my mini bag here. I'm checking for its patency. There's no tears or holes, and there's no particles in the solution, and I can see that it hasn't expired yet. And I'm also checking if this is the right mini bag. So it's 0.9% NaCl, and it's 50 milliliters, so it's the correct one. I'm going to put it at the edge so I don't break sterility. I'm going to alcohol swab the port for 30 seconds and then let it dry for 15. And then I'm going to dilute my medication into this bag. Recap. Alright, so the total volume in this bag is now 65 milliliters. And I'm going to put these into the sharps container right away. So I put it into the sharps container. And I'm going to label this. So I've labeled the patient's name, John Smith. And the drug name is Ceftriaxone. The dose is 1.5 grams. The volume that I pulled up was 15 milliliters, and the dilute is 50 milliliters of normal saline. I'm going to write in the date and the time. So the date and the time is today and right now. And I've signed it with my credentials and my signature. So I'm going to put it at the back so it doesn't block any important information that's on the front. And I'm basically ready. I'm just going to get all my supplies before I enter the patient's room. So my secondary medication set, my mini bag, alcohol swab, and my label for the secondary line, hand sanitizer, my MAR, and a pen. And then this, I don't want to leave it unattended, so I'm going to put this in the med supply room. So I put it in the med supply room. Now, I'm going to enter the patient's room. So as I enter, I'm just going to do hand hygiene. I will do a safety check for the environment. Side rails are up, the bed is relatively low, and the patient doesn't look like he's in distress. I'm also going to look at the pump here, and it's infusing. And I see drops coming from the chamber. There's no clamps, there's no kinks or air bubbles, and the clamps are unclamped. Yep. And it's running. Okay, so, hello, Mr. Smith. I'm Sol, and I'm a student nurse, and I'm going to be administering your meds today. Can I please look at your ID, or patient ID band? Thank you. So, can you tell me your name, your birthday, and if you have any allergies? John Smith, date of birth, and you have no allergies. Alright, so at the same time, I'm looking at the insertion site to see if there's any redness, warmth, or swelling, and there aren't any. Mr. Smith, are you in any pain or discomfort right now? No? Alright. So the drug that I'm giving you today is called Ceftriaxone. It's an antibiotic, and it's to help treat with your respiratory infection. Some side effects are nausea, vomiting, and dizziness, but these are normal. I'm going to start preparing your bed now. And I'll do my complete my third MAR, or med check, by comparing it with the mini bag and the MAR. So the patient's name is John Smith with no known allergies. The drug's name is Ceftriaxone. The dose is 1.5 grams, 1.5 grams. The route is through IV, and it's ordered. And the time is every 24 hours, and it's due now. So I've completed that. And I'm going to open my secondary medication set, take out this hook thing, lower my primary bag, and I'm also going to take out the tubing and check for its patency so there's no tears or holes, and the caps are on. And I'm going to clamp this so I don't lose any of my medication. So clamp it. Now I'm going to attach the mini bag to the secondary line, taking out the cap, and being careful not to lose any medication when I'm taking this out.
How are you not shaky, by the way?
Me? I don't know. I like try to control this. I don't dance.
Okay, so I've attached it. Before I forget, I'm going to add my label to the secondary line with my name, date, and time to let other nurses know who hooked this up and when. Okay, so I'm going to take this line here from the primary line, and this is the port that's most distal to the patient. And before I do that, I'm going to swab the port for 30 seconds and let it dry for 15.
I did the first time.
Take off the cap, being careful not to break sterility. And now it's dry, so I'm going to put it in. Then I'm going to back prime it. I'm clamping this. Okay. And I'll put this higher than my primary bag. And the drip chamber is filled partially. And then I will set the rate. So secondary, 65 milliliters an hour. Confirm, start, and it's running. And I'm going to check for the 3 drops that are coming from the secondary line. And I've seen 3 drops. Okay, so Mr. Smith, I have your medication running now. If you experience any of the side effects that I mentioned before, or if you have any concerns, I've got this call bell for you here, and I'll come as quick as I can. If not, then I'll come back in 10 minutes to check how you are and to see if the medication is running smoothly. Okay, thank you. I'm going to do hand hygiene again. I'm going to do a quick safety check around the environment, patient, and the machine. They're all running smoothly. There's nothing on the floor, and the side rails are up. So I'm going to leave the room, and I'm going to document that I've given the med at the appropriate time. And I'm going to evaluate later if the patient's symptoms got worse or better. Thank you.